so much, everybody, for joining us here today. I am thrilled to be here in Fergus Falls. This is just a really great opportunity. We love, the governor and I are extroverts. Maybe, I don't know if you can tell, and so we really enjoy traveling around the state and having the opportunity to hear directly from people. Nancy, you are just such a leader in this area, and so I'm excited that you are here, especially as we're doing this convening. Childcare is incredibly important to our administration, and it is the number one issue I think that we hear about. Childcare and housing are the two things that we hear about everywhere we go across the state, and we know that it is incredibly important to this community. Fergus is a vibrant and tight-knit community, so we're really happy to be able to be here today and know that the economy here is really diverse, from small businesses to the arts and from agriculture to manufacturing. But we know that there are also some pretty distinct economic challenges in our rural places, and that also includes, of course, childcare and affordability and accessibility. I am the daughter of a single mom, and my mom relied on the Child Care Assistance Program. It allowed her to have a safe place to bring me every day while she went back to school, and she got her certificate in phlebotomy, which allowed us to have just a better and more stable life. So this is deeply personal for me. I'm also the mom of a 10-year-old fourth grader who is developing her leadership skills every day, and I know they will serve her well, of course, in the future. But I also know that childcare is essential to the way that we can live our lives, right? We are all working parents in our family, and having that after-school care is really, really key and critical for us. As well as, my daughter believes that she can stay home alone after school. We're not quite there yet. So I'm like, okay, great. If you could, make your bed every morning and do the dishes, that's a good place to start, where we know that you'll be able to stay home by yourself after school. But I think we are finally in a place where we are talking about childcare in the way that we need to talk about childcare. It is the workforce behind the workforce, and it also is economic and workforce development, and we have to talk about it that way, no matter where you live. In order for greater Minnesota communities like Fergus to grow and thrive, young working families need to access childcare that fits their needs and that they can afford. And your businesses need workers that have reliable, affordable care for their children, and you know this, right? Very specifically, and we'll talk more about that as well. And your childcare providers need infrastructure and support to best serve their families and their workers. And this legislative session ahead of us, I'm incredibly excited for and very hopeful about what we can get done. There's an opportunity to make, and thank you, yes, you can clap, I love it. This has been a very long time coming, and there's an opportunity to make meaningful investments in programs and partnerships that really support our child care systems. The governor and I have included a few key proposals in our One Minnesota budget to help strengthen child care access, and I want to walk through just a few of those now. And I would say, Nancy, you know this, these are things that we've been working on for probably about 20 years, so we're right on time, I guess. So better late than never, that's right. Making childcare more affordable for families with a child and dependent care credit, increasing the child care assistance and early learning scholarships, and investing in a mixed delivery pre-K system so that parents can afford the options that best fit their needs, and investing in a DEED Child Care Economic Development Grant Program, which also works to reduce child care shortages and also support the local workforce needs in the community. And specifically, we have some policies that support child care and economic development in greater Minnesota, because we hear you and we know that there is a need. So I have talked enough. I am here to hear from all of you. So I'm just eager to dig into the conversation ahead of us. And if we could, I'd love to just go around the table and just do some quick introductions, and then we can dive in. And Nancy, we can start with you.
So good morning, and I'm so glad to have you here. I'm Nancy Jost. I work for West Central Initiative as the Director of Early Childhood, and I've been in the early childhood field for 50 years, so kind of an old lady. So I've been waiting for this moment for more than 20 years.
Say that weekly.
Every day. I was like,
Thank you for being
you'll
here.
be a master negotiator. Yes, that's right. Wonderful. Thank you.
Hi, Justine Anderson. Maggie and I are from Perm Health in Perm, Minnesota, which is about an hour away from here. I'm the Chief Financial Officer, and we are co-teaming or started an initiative to supply childcare to our employees with a partnership with the daycare center in Perm. So.
Yes, Meg Brzonki, a healthcare strategist with Perm Health, kind of project manager, working with Kaylin and our local child care center, Children's Corner, to bring more option to our community.
Thank you for making the drive.
I'm Samantha Van Wenchel-Meyer, and I work with Nancy at West Central Initiative in our development side of things at West Central Initiative. And I have a 2.5-year-old and a 5-month-old.
So you're in it.
I'm in it. I'm here to share my perspective as a parent.
I'm so glad. Thank you.
I'm Steve Gutormson. I'm the Marketing and Development Director at Pioneer Care. And I thank West Central Initiative for grant funding that helped us establish our new Pioneer Kids. This started in September. And so we're just getting started with this. Been in the discussions since about 2017, involved in the conversation, not as long as Nancy, but I've learned a lot in a short amount of time.
Thank you.
I'm Clara Beck. I'm the Community Development Manager for the City of Fergus Falls, and I am currently leading the city through the Rural Childcare Innovation Program with First Children's Finance.
Wonderful. All of my
And
favorite
Clara,
things.
your mom.
Oh yeah, yes, I have an almost 2.5-year-old who is ball of energy, and then number 2 is on the way. Right now, so-
Wonderful. Very exciting. You heard it here. Breaking news. Okay.
Do you have daycare? Did you start with daycare?
We're very lucky that we actually have family care, but we still want options.
For sure.
You know, if anything changes.
Absolutely. Absolutely. Congratulations.
Thank you very
Very
much.
exciting. Absolutely. So can we just open it up? I feel like we can just make this sort of a free-flowing conversation. I'm happy to just ask some questions, but really want the opportunity just to hear from you about, what's working, what's not working, what you wish maybe you had, and really what the governor and I should know, as well as other decision makers at the Capitol. So maybe we can start with what is the biggest challenge for your community regarding childcare? Anybody?
Well, I think you
Go ahead.
earlier in your opening remarks around affordability and availability. I mean, it is both. It's the challenge of purely finding and the quality, ensuring the quality is there as well. And so it's when I moved here to Fergus Falls 8 years ago, I was really expecting a 7-year-old, and I came from the Twin Cities. Now, well, I'll be able to find childcare, right? Oh my gosh, like I was not ready for that. So from a workforce perspective, I mean, we made it work, and the Children's Corner actually in Fergus Falls, got a variance to get my son in at that time, and they were the first person I told. I mean, we hear those stories all the time. I'm like, I really just moved here and I just got my son in, and thank you for that. But I'm pregnant. I'm like, oh my gosh, and even with that 11-month window, I had to take an extended leave on a brand new job. And so, I know those experiences, and that was 8 years ago. And so things certainly are even more challenging today than that. So I have that personal experience, but from the, the work we do across the county, it's similar stories, and appreciative now that we have employers stepping up to be partners, and as we take a look back at what we can do, what's our role as the county, as a unit of government. And we know there in this world today, in this environment, there are a lot of resources, a lot of supports that are out there to help encourage expanding childcare, making sure we have the workforce. And so we take that active role of sharing those resources, making sure they're getting in the hands of the right people, the people who are making the investments, And then helping recruit those providers, make sure there's awareness of the different types of opportunities that they can be involved, whether it's in a pod model or if in-home for a family care isn't the right fit for them to be operating in their home, that there are options and opportunities and encouraging them. And then probably the biggest role that we try to play is building those partnerships and think about how can we address that bigger issue of quality, affordable, and the availability of childcare. So trying to connect our employers, connect our other partners together, and how can we play that role. So that's baseline of what we're seeing and how we're trying to play a role.
I wonder if you would like to speak to just how you decided to get into this child care, helping to solve this problem. I mean, clearly you have good partners, right? But just what made you take the initiative to do this?
I'm gonna let Nikki talk.
All right, well, so we started with, this has always been the topic of conversation. Always, we need people to show up to work. It's really becoming hard, and nothing against home daycares, but every home daycare it seemed like in town had Fridays off. Well, I still need healthcare workers to show up on Fridays. I can't,
People get sick on Fridays.
So, we, through conversation, and we have a pretty close working relationship with all the businesses in our town, and we started having conversations with KLN in our community, and we're like, okay, we're both struggling with this. We got to do something. So we threw out a survey to all of our staff. So I know we have 600, and they have a lot. And we received word that there was 400 kids that needed needed childcare solutions between our both organizations. And that paired with our community health needs assessment that we just completed, stating that child care shortage was the #1 concern of our community. We were like, okay, we need to quit talking about it, we need to do something. So we kind of we had some vacant space in our long-term care setting that used to be a Boys and Girls Club. So we're like, we have a child care center there, let's expand. Let's invest some money, let's expand this and put in slots for our staff. And it's a small start, but we're hoping to grow it from there.
We already rented space to the partner that she mentioned, Children's Corner Daycare Center has a location in Perham as well as Fergus Falls. And so they were already leasing space from us. So it was really an opportunity to look at that expanded 8,000 square footage and think, can this be just for our employees and KLN, the manufacturing company's employees? And through a survey that we actually facilitated with KinderCare in the state before, that's how we got kind of the hours. The affordability of it was a barrier. The accessibility, drop-in part-time care, like meeting our employees where they're at and what their needs are. Because it is kind of a cookie cutter, like, oh no, we need full-time, this no fault of the centers or home daycares, they want to take those full-time people first instead of navigating the schedule of people who maybe only need it 2 to 3 days a week. And so we're still working on that, on how to get part-time care and drop-in care for our staff. But we did a $250,000 expansion and remodel to outfit to meet the licensing requirements of this center, of this space. And then we are also subsidizing for our employees the cost of the difference between the child care center cost and the average home daycare in Otter Tail County. Both KLN and Perm Health are subsidizing that for our employees. And that's about $80 to $90 a week per kid. And so we figure that subsidy is upwards of 6 figures that we are kind of just chalking up as an employee benefit, if you will, because we need staff there. We can't be on diversion. We can't have our hospital shut down. The state is already in a crisis with long-term care settings. We can't have shut down more beds. We already have shut down 17 beds. So childcare was the solution to figuring out how do we continue to provide healthcare in our small town.
That's an incredible investment, and to think about it as a benefit, but also having that reliable workforce for all of you makes a difference. How many kids are in the childcare setting?
We're just starting.
I mean, it's
so 7.
Yeah,
Seven.
seven 7 toddler spots we're opening up, and that's shared between Perm Health and KLN. And then 8 infant spots between Perm Health and KLN. So 15 spots that's shared. And with hopes of growing so that the community, Perm Health, and KLN all have a toddler, infant, and a preschool. So that's great.
And just to add, we were fortunate to receive a DEED Economic Development Child Care grant in this last round, and their partnership of that project that was planned. I know how highly competitive that process was, and so to have this ready partner there, so we will be supporting through that grant program funds for their expansion of the program.
I think that's where you start, and especially like 8 infant spots, that's like pure gold.
Yeah. So I actually am like, I had to light a fire under my contractors this week, but I have an employee that I'm waiting, she will go full-time because she got one of my infant spots. So I'm taking an employee and going from a casual status to full-time just with this one infant spot.
That's incredible. That's incredible. And then Steve, how about you?
Well, we, you touched on the capital expenditures for creating space, and that was a major issue for us. And but fortunately, or unfortunately, we have a vacant memory care cottage that was really turnkey for childcare. Because it's set up as licensed as assisted living, it could be used for that. But we see that as a temporary solution. So I have some anxiety about what's going to happen when we get to the point where we build up our workforce again and are able to use that building for its intended use. So I just see that access to capital funding for startups is really a big issue. So we have we're serving, I'd say, 10 families, and we're sharing some of the slots as well. So I'm not sure exactly how many children we're serving at any given time, but I think there are about 10 of them over there today. Yeah. And the other thing that was kind of a hurdle to jump through was possibly leadership, a workforce, somebody that was that would be the child care manager. And fortunately, we had someone come forward that was in the business for 26 years, and she was ready to do something outside of her home. So we were able to provide that for her and bring in some experience to the position. So that was really good. So the big issue right now is that I look forward to, I guess, is finding a new home for Pioneer kids.
Well, I'm super excited to see it in a little bit and to be able to read some books to the kiddos today.
Yeah, and our employees, we actually brought 2 full-time nurses back within an hour after we announced that we were opening Pioneer Kids.
Incredible.
We had 2 full-time nurses call us as soon as they heard and come back to work full-time.
It makes a tremendous difference. I'm wondering, Nancy, if you could maybe speak a little bit to this workforce issue and the child care workforce, coming back, and it's wonderful that you found someone to step into that role, and I know that is a challenge, and turnover, and making sure that we have the right people. This work is so incredibly important. It literally is providing the foundation, the first 1,000 days, right, for our children, and having a strong partner in that, and people who understand child development and child care really matters. But we don't always invest in these individuals who do this really life-changing work the way we need to. Could you speak to that just a little bit?
Yeah, I just wanted to say one other thing about Pioneer Kids that's so cool is that the family child care provider who's doing the work now, she also gets benefits, right?
That's correct.
That's
so
wonderful.
she is an employee of Pioneer and gets full benefits, which is
It is a game changer.
unusual in
Yes.
the field.
Absolutely.
Well, I do think that the workforce is one of our biggest issues, because even if we provide funding for families, if they don't have anywhere to go, their money isn't going to help them out any. So I think the workforce is just so pivotal in finding our solutions. And I just wanted to say something a little bit provocative about businesses.
You?
I think businesses should help out with this solution. I think we should work on it locally, regionally, but I don't want to let the state government or the federal government off the hook. Because, or our society, because we're the taxpayers. I don't think we should be left off the hook. I think that we need the system, and when we allow, or when only businesses are doing what they should, and the government isn't, then we don't have the system, and then we also don't have, like if I'm a parent, like Sam, and I don't work someplace that has childcare, then I'm not helped either.
Yeah.
So, just thinking about the people who work at places where there won't be childcare, and how is that equitable when we rely solely on businesses to do childcare. So I just want to bring that piece up, because I think it's just so important that the availability of childcare is so important, the workforce is so important, and we have to have a system that brings all those things together. Like we have to have the training for the workforce, and we have to have better compensation for the workforce. We have to make sure that they have benefits. Like, who wants to work for $10 an hour, no retirement, no lunch break, no time off to be sick, or holidays. So we're just asking so much of these mostly women who do this work to have this burden on their shoulders, when we as a society should be taking that on, because this is really nurturing the brains of our next generation of workers. So I don't even know if I answered you.
No, that's super helpful, absolutely. And I think that's how we've tried to approach childcare, but really I think our budget overall, right? Understanding that children and families don't come in pieces, and so we can't have that approach to how we are, we're doing this funding. The opportunity, I think, with this budget, I think helps to address a lot of the things that you just lifted up. One of the things that, if I had my favorite policy or my favorite budget priority of this budget we proposed, it's our child tax credit, which by itself will lower child poverty by 25% in the state. This is real money. It's real money for families, and so this credit would provide $1,000 per child for lower income families making less than $50,000, with a maximum total credit for each child of $3,000. The credit would phase out starting with families making $50,000, but that can be a real game changer for folks. And the other piece that I think for a lot of the families that live in this community will make a big difference is the dependent care credit. So this is a significant expansion to the state child and dependent care credit that will mean $8,000 for middle class family of 4 with 2 children under the age of 5. That's you. And the credit phase out begins at $200,000, and so it will reach 157,000 families across the state. And so these are the things I think we talk a lot about, low-income families and the need to invest there, and it is key, it is critical. We also know that there's a lot of middle-class families who are struggling with childcare. The biggest raise that I ever received was when my daughter started kindergarten and was in all-day K. And so I think these are certainly ways that we can approach this. And then the stabilization grants make a huge difference, and we want to continue those. So that's more than $350 million per biennium for retention payments for childcare programs to support increased compensation for their workers. This money, 100% of it, has to go towards compensation and towards the workforce, as well as recruitment, training, and support for providers starting or operating childcare businesses. I also want the same women, who are working in our childcare centers to also see this as a viable career opportunity for them. The opportunity for cooperatives, for that second and third shift work that is really key and critical. I think that matters. And when we have the highest work participation of women in the entire country, in our state, this matters tremendously. So we hear you, and we hope that this approach is helping us to really get there. Sam, I'd be really interested to hear from you as you are in the thick of it. You look incredibly well rested. very young children, and so would love to know just what your experience has been, and what you think people who are making decisions, who maybe don't have little ones, or who are like, oh, childcare, that was years and years ago. What would you tell people?
Well, first, thank you for all the work, and I took a shower. That must be why I look well.
Very exciting.
I still wake up 3 times a night. As I was thinking about all this, I was like, I really come from a lot of privilege in my experience with childcare, in that I'm in my community that I grew up in, and I have connections here, and my family's here, so I have all those things that are helping. My childcare provider is working on retiring, and I see that the accessibility to childcare is that it's a lot of aging providers in the home care area. And my sister has a son a few months older than ours, and so he's 3. She's been in 3 different childcares currently, because her first retired, her second did not work Fridays, and she's in healthcare, so she needed Friday care. And now she's in a 3rd center-based care, and her provider that retired was our babysitter, our daycare provider when we were kids, and my current daycare provider has been doing this for 40 years and working on retiring, so she's taking summers off. So I get the opportunity to bring in a nanny for some assistance in the summer for that piece of it, and we did hear when we started that she was working towards retirement and got on a wait list for our next provider. Yep. They said it was 2 years, and so it's real. The accessibility is very much an issue.
Absolutely. I have a 12-year-old non-neurotypical child, and so I went through 4 child cares back in the day, because at that time he was in a home daycare, retired, and then had to find another one, and found one. The behaviors started presenting with his disabilities and got kicked out. Then we started early preschool as a solution to the child care struggles there, got the IEP going, went to Boys and Girls Club as an after school solution, and got kicked out because of the behaviors. And so we have the neurotypical daycare stuff, but we also have the non-neurotypical that does impact a wide array of our state that just doesn't talk about
That's
it.
right. I was just going to say, Justine, we don't talk about that enough, so I'm really grateful that you made that.
You made the comment of the tax credit of $1,000, and then what was the income limitation on that?
So currently proposed the $1,000 per child, up to $3,000 for the child tax credit, and then the credit would start phasing out for families making over $50,000. So this is for families in deep poverty, and then the dependent care credit is $8,000 towards child care for a family of 4 with 2 children under the age of 5, up to the phase out begins at $200,000.
The only thing, the whole entire state has seen the labor demands increase specifically over the last year, and I know it's not just healthcare related, but $50,000 probably doesn't touch a lot of our population of employees. Right. If there's any fuel for thought is to consider increasing that, because like you mentioned, the middle class, and that 50,000 and less is deep poverty. I get your intent with it, but there is that need for the housekeepers making, maybe they got the push up to $20 an hour, which is creeping up on the 50, but that's still a real struggle. So
absolutely, and that's I think why we want the 1-2 punch of the child care tax, or the child tax credit, and then the dependent care. The other thing that that we continue to push for, the governor and I, are direct checks to families. We have a budget surplus of almost $18 billion, and we think there's an opportunity to give some money directly to families, and the very families that you're talking about. I think the people who sort of brush that aside, in some ways I think you're telling on yourself, because you haven't figured out how you're going to make $20 last for the rest of the week. And this is an opportunity, I think for first and last month's rent for folks to get into housing. It's school clothes. I don't know about you, but my child goes through shoes, both just like from growing, but also just wear and tear. She's a skateboarder, so that's a whole thing. But I think that there are ways that we can give sort of this long-term investment into the child care system, investments into families with the child tax credit, the dependent care credit, and then that really immediate relief for direct cash payments to families.
Can I ask, are you doing anything with the child care subsidization program with this package? Because recent personal experience, my husband's finishing up PA school, which has been a long 2 years. I have 2 kids, similar ages, and we recently tried to do the child care tax credit because we were living off my income. Had to wait 6 months. Then found out who did all this work, making ends meet, and then we found out we didn't qualify because all the things. Regardless, 6 months. So then I'm coming into this project, figuring out, okay, if I had to wait 6 months for an answer, I made it work. It was tight, but we made it work. And paying for child care center tuition for 2 kids. But for the housekeeper that doesn't know anything about it, because it was awful to find information on it. I didn't know I had to call my local community action to get access to the paperwork. I was trying to figure it out online, didn't work. And then wait all this time and sorry, never mind. So I just wasted all this time, but how can I help as staff get involved earlier? So I've now worked with our HR department to get the paperwork included in the FMLA ask. And, but I was like, that was a nightmare. That was an absolute nightmare to get even considered. So how, is there any, yes, we're doing all the tax credit, but is there any support to the existing programs that do help make child care center tuition a lot more affordable?
Yes, so one of the things that we have proposed is with the child care assistance program, raising the reimbursement rates to the 75th percentile, which we think will make a tremendous difference for families, both for center-based care, for in-home providers who take CCAP kids to be able to rely on that. I think there are a lot of providers who just out of their goodness of their hearts make it work. And we want to make sure that we are keeping up. And just generally, I think it's important to note, I think we think of this particular budget as a way to catch up. 20 years ago, the child care assistance program was just decimated, and we have never made up that difference. And we continue just to see over the last 20 years, but 30 years, how many women are now in the workforce, how many parents, we have both parents who are working, or a single parent who is working, and this need, it just looks different. We don't have folks who are able to, to stay home to provide that care. It would be an incredible gift if more of our families could do that, but we feel like, this is important for that stability. And there are, we don't make it easy for families to navigate through the system, and I absolutely hear you. And so having, as you talked about, the deep relationships here, being in the community where you grow up, I have a similar experience. I live in St. Louis Park. It's where I was raised. My daughter's preschool teacher, Jan, was my preschool teacher, right? It's all, and so all of these pieces, but I think that, the West Central Initiative, the county, the city, there's opportunities, and it sounds like Fergus is in a place where you're just being more intentional about saying that this is a priority for our town, but we have to keep talking about it. And I feel like it's like, well, moms are hustlers, and just make it work, right? And you're gonna be with auntie this day, okay, I can take your kid on this day. There was a chunk there of time where our family didn't have access to childcare while I was lieutenant governor. I can get fired, right? But my daughter would come along with us to stuff, or would go to auntie's house for a while, and you just have to figure it out at this, while also focusing on your job and the things that you need to do from day to day. So we can do better. I think this is a really solid step in the right direction. But I'd love to hear from you a little bit about how Fergus is really focused on this issue. How are you talking about it, and how is it an issue that affects everybody, even if you don't have kiddos who are in childcare right now?
Yeah, so we've really hit it kind of from the economic development perspective. We have obviously a huge workforce shortage. We have local manufacturers who are like, we're desperate, we need to get people here. So that's one of the ways that we've really brought like a diverse group of a lot of people from different sectors of the community together to have these conversations. When Amy was actually with the city, she's the first one who started convening some groups to get together.
Yep. Oh, this is an issue here, people.
Yeah. So I'm gonna really credit Amy for getting the ball rolling on a lot of this. But so we've been having these conversations for several years. And I've been with the city for I think like 3.5 years now, and so it's been a priority. Since Amy left, since I started, it's always been something we've worked on. The pandemic really kind of decimated a lot of the work that we were doing. People weren't comfortable getting back together, coming up with solutions, and we had kind of lost our track forward, because you can, you come up with different ideas here and there, but how do you actually see those ideas through? How do you make those real connections to say, okay, I have piece B to your puzzle here, how do we get that put together? So when First Children's Finance's Rural Childcare Innovation Program kind of got on my radar, I'm like, maybe this is a good way to reset us and get us moving in some kind of like a concerted direction. So we applied to that. We got started back in I think September-ish, and we'll be on this track for the next, I think we've got another 9 to 12 months of the process. So we've been engaging the community in events. We did a provider appreciation event actually in the end of December, early January. That was a lot of fun. We've gotten great feedback from that, from the providers who are like, we don't get together anymore. It's great to be able to see other providers and make those connections. So I think that's something that we're going to keep doing, because we do want to elevate that workforce and say what you're doing is super important. And we want you to see that like this is a genuine career that you can have. Right. And then back in, I think also in January, early February, we had a town hall event where we had a lot of people show up to the local college and listen to what the issues were, and then start sharing the solutions that they had. And so that's kind of the track that we're on now, as we've distilled down a lot of those ideas. We've got these smaller pockets of the community who are working together. Steve's on one of my committees, Nancy's on every committee.
Of course.
Yep. And well, she's at least on the email chain.
Yeah, don't give me too much credit, because I don't deserve it.
So we're trying to find like the solutions that are gonna work for Fergus Falls, and trying to fit in with the work that the county is doing, the work that we're seeing happen at the state level. How can we influence federal decisions? And it's been a really interesting process. We're gonna keep going down this road and see where it takes us. But right now, a lot of our focus is on workforce development. How can we get kids, even at the high school level, interested in childcare, like a career in childcare, make that something that they want to actually be doing. So that, because we do have an aging, we did some studies when we started with First Children's Finance. We have an aging population of care providers right now. Like a huge percentage of them are probably going to be retiring in the next 5 to 7 years. So we've got a dearth already, and it's just going to keep growing. So yeah.
Well, that I think. Oh, go ahead.
I was going to say, you mentioned the school. So in Perm, we do have that program where you can come out of high school with your early childhood degree. We have that feeder with Penn State.
That's great.
Amazing. So there, I know.
We all should talk.
Yeah, I know. I was like,
tell her about the high school.
So I think we had, 6. I don't even know the numbers, but we have that feeder program, and luckily the center we're affiliated with, she was the leader of that program. So
that's wonderful.
We have those connections, thankfully, but we are trying to get that in the hands of the high school students. They can come out and start working right away in a career that's worthwhile and very meaningful. So it is a good solution. I'm happy to connect you with that.
I love it.
Detroit Lakes also has that in their high school.
Fergus Falls can do it too.
That's right. They're working on it. Yeah, that's right. I love it. Well, I want to be respectful of time, but I think if I could ask just one more question to kind of wrap it up, and you started to talk about this. If we were to share your experience with another community, is there anything that you do differently or that you would recommend they do to be successful as they're starting to tackle this issue of childcare and workforce. Heard a lot of good ideas, but anything else that you want to add?
Listen to your providers. Listen to what they actually need, because we've had some instances where we're like, this is a great idea, we should totally do this. The provider like, you don't actually need that. Thank you.
Very sure. Keep focusing on employers, but like Nancy said, it's not the only answer. It's just not. There are a lot of practical reasons why it's a benefit. Like at Pioneer Care, we have these 2 nurses who work. They share a slot at work and they share a slot at daycare because at childcare, because they can, because we coordinate with them to do that. So there are some benefits to having that strong connection from employer to childcare, but it's not the only answer.
I think one of the statements that Nancy made about early childhood providers developing the brains of our next workforce really stood out to me, and we don't give enough credit to our childcare providers for that work. And after we're done, I have to show you a video of my 2-year-old son, who my provider has helped him to learn his full name, first and last, phone number and address, because if he ever gets lost, disconnected from family, he can now tell a stranger how to connect back to us. And so
At 2,
he can do all of that, and it's amazing. Like, she has done so much to develop him in his education.
Incredible.
I know.
I love it. Anybody else?
Okay, so I kind of got 2 things. So from the employer side, yes, you're correct. It's not the end all be all, but one thing I really love about my job and working with this organization and Kaylin is like we just quit talking about it and did something that was really powerful, and we're making a shift. I've done the jump around, okay, you're gonna be with this person this day and that is so stressful, and I couldn't do my job thinking about, okay, where am I putting my kids tomorrow? And it's not a work-life balance anymore, it's a work-life blend, and this is how we are answering that call. So from an employer standpoint, looking or advice to other communities, it's like, okay, we gotta think differently, because if your kids aren't safe, you're not gonna be a productive worker. My ask for the state is, can we please look at licensing for childcare centers and how stringent and such a process. As I'm going through remodeling this space and saying, I'm literally handing this space over, and they're like, well, we can't do this because of licensing, and we can't do this because of licensing. And I understand child safety, get it 100%, but I couldn't use a room because I couldn't put all kids in there because the square footage was off, even though I was only going to use all kids in there 1 time a day. So I had to take it all the way to the top to get licensing for that room, or a variance for that room. And I'm like, no wonder nobody wants to do this. This is hard. This is like the silliest little things are putting barriers in our way. So my ask for the state level is, can we take a look at the licensing? Is there some middle ground we can find in when businesses do have space, it's not doubling the budget because we don't meet the licensing requirements.
I think, that taking action, thinking about what's appropriate from what vantage point. I talked earlier about where we thought from the county, what is our role? We're not going to build and operate childcare. Day one, we said that's not our role. But what can we do? And then we took action. And so really, I think that's what I do have a number of other counties and communities who have reached out to say, what are you guys doing? And that's kind of the message I give them is, and engage the right people. Talk to your providers, talk to your employers. There are solutions, but you just need to bring the right players to the table and have the right information in your hands.
Just that this is a really complex issue that's going to take complex solutions. It's not going to be solved by only changing regulations or only, training people better. It's just so complex that we really have to look at it as this system of complexities that all have to be taken care of.
Well, thank you so much for joining me today, and I think, Nancy, that's a great place to end. I think that's how we've tried to approach this in this budget cycle. But I am really inspired by this community and by Perm, thank you for driving over and knowing so much of this is regional. And I know that we want our communities across greater Minnesota to be a place where families want to live, where you put down deep roots, where folks have opportunities. There are clearly jobs here, right? And so we want folks to be able to meet their needs with housing and childcare and feel that any place you want to live in Minnesota, there's opportunity for you. So thank you so much for just being a model for that. The governor and I are going to continue to listen, but thank you for this arsenal of stories that I now get to bring back into our conversations. We will absolutely come back and visit. I'm going to have lunch with Mayor Ben a little bit later, and so we'll talk all about this. I know that he is way on board for these investments in childcare as well. So just thank you for everything that you do to make your communities more robust, and just appreciate you, and happy to take any questions, comments, or snide remarks from our press who are here as well.
Yes, Lieutenant Governor Flanagan.
Yeah.
I would actually like you to answer Maggie's question about can we look at licensing, because that is not the first time that has been brought up, and it seems like a lot of the initiatives are financial based for tax credits, direct checks. Yes, that can help with costs and everything, but the licensing problem really hinders that availability. And what can you guys do executively to roll that back or legislatively?
Sure. So I think that there's opportunities, as you said, for a variance. I think that there are ways that we can look at some of those common things that come up repeatedly. But I do think a lot of the rules, a lot of the regulations there are there because of safety. They're there because of some tragic event, oftentimes deep injury or loss of life. And that is our primary, our primary lens. Our job is to keep people safe, and they're there for a reason. But I also know that we're working really closely with DHS to try to make some of those changes, to listen to providers. We want to make sure that childcare is as accessible as possible, that there are some of those barriers there that can be removed. The ones that are there for safety, we need to keep in place. But I've been doing this work for a very long time, at least in the policy making world, not as long as Nancy, but these are the things I think that came up when I was in the legislature and the child care lead for the House DFL. We heard a lot about these pieces. There's some things that we were able to change, but we continue to be open to that. Having square feet for kiddos when it's a room that's used one time, per day, and you need a whole additional, there are things that we can talk about. I'm glad that you were granted that variance. Me too. But a lot of money on that room. And there are processes, right, that are there in place. But I think we're absolutely, with DHS willing to look at those things. And I think for a policy making year, this is the budget year and this biennium, for a policy making year, I think there's opportunities for more of these conversations across the state about how we can make it easier for folks to open centers in home providers, but always maintaining child safety as our top priority.
Now, as we look at the budget surplus that Minnesota has, is there any possibility of getting some maybe tax incentives or grants for commercial businesses like Pioneer to open childcare in their businesses, or maybe even special grants for community childcare centers?
Yes, I think that's all part of our overall package. This is something that the governor and I have been open to for quite some time. I think we just saw Hormel is opening childcare on site. They know how incredibly important that is. So we're open to as many ideas as possible. We think the stabilization grants, the partnership with DEED, those are the things that make a difference. But any way that we can expand childcare and give incentives to those businesses, while also remembering that there are folks who can't access it through their business, we're way on board.
We've got time for one more question.
Daily Journal.
Yeah,
Okay, so
I'm going to spend a lot of time with you later.
Yeah.
Right?
So in Detroit Lakes, our main, I guess, kind of childcare provider that is probably the biggest in town, they recently went to a nonprofit model because it made more sense for their bottom line as a nonprofit than a for-business model. So do all providers, are they going to be going down that road because it makes more sense to apply for grants for the stopgap funding measures instead of like easing the regulatory burden and stuff?
Well, here's what I'd say, and Nancy, I'd be curious if you have anything else to add on that. I think that this whole model is broken. We have families who need care and they have to be able to afford it. We have families who are making choices to stay home because it's cheaper, right, than paying for childcare because that's where their entire salary goes. I want every family in Minnesota to be able to make the decision that is best for their child through their development, affordability, and I want providers to say, I'm going to go into this because I love children and I know that I can have a family sustaining wage doing this work. We need more support from our federal partners. I was hopeful with the previous proposals from 2 years ago. It would have made a tremendous difference. But if Washington can't work on this, we're going to do it here in Minnesota because we know how incredibly important it is. Nonprofit models, for-profit models, in-home care, folks who take early learning, scholarships, pre-K programs based in our public schools. That mixed delivery model, I think, is important to the overall health of early childhood options and the economy overall. But we need to make it easier for folks to both access childcare and to do this work. And Nancy, I don't know if you have anything else you want to add.
Well, I just wanted to say that regulations have gotten a bad rap. One of the things is that people aren't making enough money doing this, and so they're quitting. Like if I used to be a family child care provider, I used to also be a teacher at a center, and if you don't make enough money, then and that can't be fixed, then I'm going to talk about those regulations are so bad. So it's in people's, want to find an easy solution for this, and that solution often seems to be, well, if we lessen regulations, we won't have a problem. But the thing is that Minnesota has less regulations than some states, more than others. But every state in this country has a shortage. And one of the biggest reasons is because the women who do this work are not being paid a wage that values the important work that they're doing. And so regulations aren't just about health and safety, but remember, our brains are being built at that time of life, and we can't get that time back. So we have to make sure that those child care environments are the best place they can be for children, not just their health and safety, but their brain development. Sorry, that's a soapbox that I can get on.
Okay, thanks so much, everybody. Really appreciate it.